Hi, I'm Dr. Dana Rosedal, and I've had the privilege this Friday and this weekend to be with Dr. Joseph Pendergast, and I actually shadowed him Friday for the morning and got to see what his clinic's like, the type of patients he takes care of, and actually ask tons of questions and see the protocol that he's becoming quite well known about in action.
Well, I hope you're having a good time with all of us teaching all these new things and these new machines and all the other stuff. We all like to do these things, and I think they're fun. Are you having a good time?
I'm having a wonderful time. And I'm learning about the BPro machine, which is new to me.
The BPro is something that I'm going to have to explain to everybody as we go along, but it is more than a blood pressure machine. It's like our CV profiler we've used before. An advance on it, measuring different sites within the arterial tree. And it is something we think is going to make health better and cheaper, which is really good too.
What I'm finding about the BPro is it allows me as a clinician to begin to screen patients and maybe to begin to have them ask, well, what do I really look like from a health standpoint when I'm looking at my heart from the inside out? And all of us would like to live to 100. So we can start it right now as clinicians. And I have a couple of colleagues in my area that are using it, and they came to talk to me about it. So I said, I need to know about this.
Well, it's really good to have you here, and I know you're soaking every bit of information up, so I know this will be terrific. So we'll be talking more in the future, but is there anything else we need to teach you today?
I'm thinking. Probably what I'm most interested in is not something related to BPro. I guess I'm interested in something that's a little bit more physiological, and that is something you made a comment today about the use of Diovan and how it's changing the actual structure in the arterial walls. I don't quite understand that. Could you answer that for me?
Yes, this is fun because this is something I love. Thank you for bringing it up, because the Diovan we use to augment all the wonderful things that is started within the artery innards, so to speak, the endothelium, with the arginine. This begins as a force, if you will, going back through towards the outer part of the artery to make it all go back to normal. This is called the process of making everything better, so that when the cardiologists look at everything, they'll see it looks like a very young artery. This is called modeling in terms of cardiovascular terms. So it's simple, but it's very complex, just as you say.
You were commenting about how we need to put people on a higher dose of Diovan, higher than 160 milligrams a day. And I was really curious, are you doing that in divided dosages, and are you slowly tapering patients up?
Actually, I'm using other agents rather than try to get in fights with the insurance companies. We have the ability to use more, for example, the arginine, which does increase the power of this reversal, this power of having everything go back to normal. And then we use other agents altogether. We use other drugs that are prescription, things like nitroglycerin, and we use Renexa and a lot of other drugs that can just say, hey, we just push that pedal down a little bit more, and what we're getting out of this is better and faster return to normal. This is the way I try to do it.
So what you're saying, it's very synergistic, and there's a combination of supplements and then this nutraceutical, and the result has been short of, I guess you'd say, remarkable.
Absolutely. I didn't even know what this concept was about modeling before I started it, and that I suddenly have been told some time ago, this is a term of art within the cardiovascular field. We don't see it very much, but we're doing it now all the time. It really is fun.
And then you brought up a comment that kind of hits me in a very special place, and that is, and it's controversial, there's a point in time with the modeling that one could actually take a person off of their hypertensive medications. And for a doctor to say that is very radical. And you're preaching to the choir when you say that to me, because that's part of what I really want to be able to do as a clinician.
This was really fun, and when I got to present it to the American Hypertension Society privately to discuss all the information that we found, we were able to get people off blood pressure medication. It really opened up a new world with all the present physicians that were in there. So we're about to pull it together and put it into a paper form and write it to the world, because we now have many years of follow-up, maybe 5, maybe 6, and it seems like we have not had to restart the blood pressure medication for most people, which is really good.
Well, I have to thank you for allowing me to come to your clinic Friday and Saturday, and for those of you who might be wondering what's going on here, get on a plane and fly out, and I think it will change your view on how you treat patients and the role of supplements in your care.
Thank you very much for all you said and all you do. It's great to have you here.
Thanks for inviting me, and thanks for your time. It's been wonderful.